In North Dakota, it's estimated that endometriosis affects around 39,000 women in the state, and some may not even know that they have it.
Like anyone who has a garden and dandelions, you either kill them, but you can't just lop them off with your lawnmower. You have to get the root out, or you have to put the poison, and we don't have a poison for endo.
Endometriosis affects around 1 in 10 women. However, that number is thought to be more because many don't know that they have it. Symptoms that include headaches, fatigue, heavy menstrual cycles, dizziness, ovarian cysts, body aches, and GI issues are the most common and are often overlooked and misdiagnosed. Doctors say that symptoms can appear as early as the beginning of puberty.
So the big thing we want to share now is if you have any signs of it, even if you've been told by a healthcare provider that you don't have it, let's take a look at your records again and kind of comb through that and get you into the hands of some other healthcare specialists and grow your team.
Dr. Harding works with many patients who have dealt with endometriosis and is able to diagnose patients by looking at their family and personal medical history. She says it's her own experience with endo that has led her to help others because the diagnosis can take years and can cause a lot of frustration and depression.
But it's really devastating how long it takes, and because of that there is that mental health component that gets brought in, the medical gaslighting. They've been told it's nothing, or it's normal, or they've only been offered birth control as the only option, or they maybe even have had a surgery done and they were hoping for that diagnosis and they didn't receive it. There's still hope.
Hope Sheely, who is a licensed professional clinical counselor and owner of Encourage Therapeutics, has also had her own experience with endometriosis since she was 8. She says that as a mental health care provider, her thoughts of depression and suicide concerned her. However, it made her think deeper about the connection of body and mind.
You cannot have physical pain without having mental pain.
Sheely was misdiagnosed for many years. However, after living with endo for a long time, Sheely finally found hope.
I had the endometriosis surgically removed, and I was able to have a hysterectomy, and my depression and thoughts disappeared.
So, in order to raise more awareness about endometriosis, there will be a free screening of the documentary Below the Belt, which depicts the struggles of the diagnosis that women go through. Sheely and Harding will also be there alongside other panelists to talk more about the struggles that come with endometriosis.
That's really what people can expect, is a good broad brush understanding. And then the focusing that there is legislation in place that is also trying to support this on the federal side to get the funding, to get the research.
The event this Saturday at venue in Mandan at 3 p.m.